I've seen a lot of discourse saying that the American medical system is all about treating disease and not preventing it. But this is not true. One of the biggest forms of prevention is vaccination. In addition to that, any type of screening is preventative care. Screening colonoscopies, pap tests, routine blood tests, skin exams, mammograms, HPV screening, PSA screening, prostate exams, and more. These are all examples of screening, and some of them are even prevention, like colonoscopies, removing skin spots, and early detection of something. When we talk about screening, there are typical ages that are recommended, unless you have an increased risk. You can find if you have an increased risk for a condition by talking to your doctor or a genetic counselor like me. Additional screening may be indicated depending on your personal and family history. If you want to learn more about what screening is recommended in the United States, the U.S. Preventive Service Task Force has an app where you can look this up and look up the ages that are recommended. Also, an annual checkup will help you stay on top of any screening. And there are screening for everyone at every age, even people who think they're healthy. Even if you are the healthiest person, it's still really important to undergo some of this screening. For example, one of the most common single gene disorders in the United States is familial hypercholesterolemia. The genetic disorder, found in about 1 in 250 people, increases the likelihood of having coronary heart disease at a younger age. But if a person doesn't know they have increased cholesterol in their blood because they're not seeing their doctor for normal screening, then they're not going to know that they need more of that screening and that they need genetic testing or medication management. When we talk about when to do screening and who should do it, these are called guidelines. Guidelines are simply consensus statements made by experts. If you fit what the national guidelines recommend for somebody to do certain screening, it should be covered by your insurance. So most insurance companies do follow these national guidelines. If there are guidelines to back up what you are asking for when it comes to your medical care, you should know them and you should be able to use those to ask your doctor for something. If they refuse, ask them to document that you brought up the guidelines and you fit the guidelines and why they refused so that you have it in your records. You'll want to make sure that they document why they're acting against national guidelines. Just to give you an example, I use the National Comprehensive Cancer Network in my TikToks to explain when people actually qualify for genetic testing for cancer, which is often. And when people get pushback, these guidelines are available to cite to show that it should be covered and that a consensus of experts have determined that that person should be screened or at least offered screening.